Assalamualaikum warahmatullahi wabarakatuh, and very good day, everyone. So I'm Dr. Rosan Zambakria from Department of Psychiatry. So this is a pre-recorded lecture for Year 1 MBBS IIUM. So I will share the recording on my YouTube channel. At the same time, I will pass on the copy of the PowerPoint slides so that you can refer on later. Let me just open up my slides. Alright, so today's topic is psychological development during infancy and childhood. You have two lectures with me for this current block. Another one will be on attachment and parenting. But let's focus on this first one, psychological development during infancy and childhood. So these are the four main objectives that we'll cover. It's a rather huge topic actually, but I will highlight to you the importance part where you have to remember and in which area that we might be test you on. But I will include other parts even though we won't be testing those parts because it's important in order for you to understand the bigger picture of development in childhood. So I'm a psychiatrist with special interest in child and adolescent. In psychiatry point of view, we do have set of diagnosis with that is specifically um, focusing on mental disorder among childhood. Nevertheless, even though it highlights mental disorder per se, but what's also included under mental health problem of childhood is what we call a neurodevelopmental disorder, which includes problem of development such as autism, ADHD, intellectual disability. So in order for you to understand what is wrong with the development of any child, once you become a clinician, become doctor later on in your life, you have to know what's normal first. So that's the main reason why we need to cover these topics. If you don't know what's normal, you won't be able to appreciate what's abnormal in terms of children development. So we'll talk about domains of development. We'll focus specifically on the psychological component, but it links or correlates directly with other development of childhood. So we have to talk about other domains as well, so that we'll understand what's the relationship between the psychological development and the medical aspect or physical aspect of the child. There are many theories explaining psychological development in childhood, but we'll be focusing on only three: the psychosexual theory, psychosocial theory, and cognitive theory. And latter part is will specifically focus on adolescent development. Okay, so as I said, it's a huge topic, but bear with me. Hopefully, during face-to-face session, we'll be able to clarify if there's any problem or things that you understand. Now, this is a common questions that you see in a social conversation. So whenever you see a child, one of the things that normally people want to know, how old is the child? So people will answer 2, 3, 4, depending on their chronological age. But as a medical person, as people that learn more than just the the um, obvious part of human being, we also try to appreciate human from different perspectives. So when we talk about child, um, it's important to highlight that there are more than just chronological age that we need to look at. The child may be 5 years old, but how about his physical age? Is he developing according to 5 years old milestones from physical point of view, weight, height, hip circumference, so on? How about mental age? Does this child thinks like a 5 years old, or could it be more or less? How about his social, and how about his emotional age? And more importantly, uh, not only in childhood, but even in adulthood, sometimes we do talk about differences in these domains. I'll give you an example. Sometimes we do get patients come for depression, adult that comes for depression. But then when we look into details of his social development, his lifestyle, the way he thinks, then we realize that even though physically he's maybe 25, 26, but the way he thinks, or the way he socializes with others, or the way his emotions are developed is less than 36. He's maybe like a teenager's. So this actually helps us to understand why it happened. Now, in clinical conditions, sometimes we do cases like Asperger's disorder or adult autism, for example, that suit this description. Right? So it's important to understand all different perspective of human being other than chronological age. So maybe it's a good idea to ask yourself what's your physical age, mental age, social age, emotional age as well. Now, when we talk about development, we'll be talking a lot about stages. So there are different stages that you have to remember, things that happen at this stage, different stage, this years, and after that, what happened after that. So this is what we call stages. And interestingly, this is what also highlighted in the Quran. So in Surah As-Sajdah, for example, Allah mentioned that then He proportioned him and breathed into him from His soul and made for you hearing, vision, and hearts. Little are you grateful. Now, what's interesting about this ayah is um, Allah described that the development is proportioned based on different um, categories or different areas. It starts with hearing, and then visions, and then hearts or al-afidah. So interestingly, when people learn about embryology, and then they discover that the development of um, children or development of the fetus actually follows this order. So circuits of the brain for hearing develop first, followed by vision, and then the rest. So, in other words, that everything has to follow its order. Everything has its gukun or stages, right? So, as mentioned, so sensory, then language, then higher order function. So it comes in stages. Um, to sum up the developmental aspect that we need to look at, basically it falls under three main categories. Number one is biological development. Number two is cognitive development, your thinking part, your brain part. So that's the first one is your jasad part. The second part is your akal. And then the third part is your social, emotional, um, your roh and your nafs. So the physical domains, of course, includes your body size, your appearance, your brain development, your motor development, your physical health in general. Cognitive development includes all that falls under the function of the brain, which is attention, memory, problem solving, imagination, creativity, academic, everyday knowledge, metacognition, and language. Metacognition is thinking about thinking, thinking about the way you think. The third one is social, emotional domain. This is about your your ability to connect with others, your ability to understand about yourself, your identity, ability to identify and process your emotions, and develop relationship based on this. So these are three major domains of growth. So it occurs regardless. Childhood, infancy, adolescent happen chronologically based on stages, but based on and all guided by or categorized into these three domains. Right now, how are they related? Physical, how is our physical development relates to our medical development or medical problems in childhood? How are they connected? So this is something that I want you to think about. And during the face-to-face session, I will ask questions. I want you to think about what's the relationship. Can you give example? How are these two related? Okay, now I mentioned about neurodevelopmental disorder just now, so this is what I meant. Um, you won't be going through details of this disorder, you learn it during clinical years, but these are an example where when people have problems in their development, it become a disorder, and that disorder is named into different categories. All right, now when you understand about your when you're trying to understand about development, we'll come across a lot of theories. So what is theory? Theory is a set of ideas which is put forward in order to describe, explain, and predict behavior. So whenever someone's developed a theory, for example, you develop a theory that every time I eat, I'll become full, and later on I become lazy, and subsequently I become fat, for example. So that is an idea. So if that idea is able to describe every time it happens, and able to describe every single thing that happened under the domain, and can predict what will happen if you follow that set of rules, therefore it becomes theory. So you can name that theory. Why is it important? Because it gives meaning to what we observe. For example, why at some point in our life we thought that moon is following us? That's an interesting story that I've asked many before. Have you thought about that incident or that experience where when you are in a car, then you notice that um, the moon is actually following you? At that point, you might felt like you are an important person in this world where moon have to follow you. And when did you realize that moon is not actually following you? So what happened there? Why? How did that develop? How did we establish that it wasn't the case? Right. So this is something that's actually can be explained by um, a cognitive theory, something that happened as part of our growing experience. Talk about it. Okay. Now, just a little bit about history of developmental theories. You don't have to worry about it. I won't ask about this. But what I'm trying to highlight is even though we as Muslims have understood that development occurs through stages, there's a rule and room for different things in childhood. For example, we have differentiation of those who are mukallaf and non-mukallaf, mais and non-mais, balik and not balik. So Islam has a rather interesting and intellectual way of differentiating psychosocial development of children. But on the other hand, Western actually had trouble in understanding this. Um, it was it was not until 20th century that they fully understood um, development theories as it is today. It's irony that we claim that we know a lot before them, but eventually we resort to following their theories. That's the reason. One of the reasons is because we did not elaborate our knowledge and theory as well as them, so that we have to rely on them uh, to get the depth of the knowledge that they have already um, provide us. But this this slide is actually want to highlight that up until um, 16th century, they were still clueless about role of children. They will still have issues with child labor, human rights violated with regards to children and whatnot. And later only they learn about the importance of appreciating children in order to prepare them for adulthood. Right. So since then, there have been few theories developed: psychoanalytical theories, behavioral and social learning theories, biological theories, cognitive theories, system theories. We'll be focusing on three theories during this slide or this discussion. Number one is Freud psychoanalytic. Second is Erik Erikson social theory, and then Piaget cognitive theory. Alright. So basically, this theory is um, used to explain what happened in each stages of development. So it provides us a framework to understand what happened during 2 years old, why 5 years old behave in such way, why 12 years old behave in such way. So these are some of theories. We will start the first one, Sigmund Freud. So Sigmund Freud is a psychoanalyst, a neurologist um, from Vienna who during his century come up with theories to explain about human development. He's a he's a biological person. He started off as a scientist and later become a neurologist. But then he came across patients with illness that he couldn't explain biologically. One of the example of this patient was a patient, a female patient who had traumatic life event, later developed paralysis, hysterical-like paralysis. He couldn't explain it from biological point of view. He didn't think there was anything wrong with this patient medically. But later he discovered psychological issues, which from there he started to expand his theory on this and became a father of psychoanalysis. Psychoanalysis is basically, in simple terms, is um, the way of explaining what's going on in your mind, in your psyche, your soul. Okay, so his theory is based on his therapy with troubled adults. He emphasized that the child's personality is formed by the way which his parents manage his sexual and aggressive drives. This is what's interesting about his story. So his idea was everyone is born with a nafsu, in the form of sexual and aggression, and what you do about it will determine how you develop as a person. Not everything that he said is actually in line with our religious understanding, but some of it is um, uh, some is relatable. We'll talk about it. So what his idea was, each stage of development, 2, 3, 4, 5, 6, has a primary focus. That is the target where this graph will focus, and then later it resolves. But if it didn't resolve, the failure to resolve will lead to psychological problem. Okay, if you don't understand this yet, it's okay. I'll give you the concept. We'll talk about it later or during the session itself. Now, uh, this is basically what his idea was. All you need to know is what are the stages. You don't have to remember the description or the ages or the problem. Just have to at least some idea what are the example of stages that was talking about. What I want you to know is just to get some idea what it was he talking about. So you get example. For example, the first 2 years of life, the focus of the drive, the sexual and aggression drive, is oral. So everything is directed to oral. Because during this stage, according to Freud, the world of a child is revolved around sucking and tasting, breastfeeding. Everything is focused on the mouth, right? Now, if everything goes by its order, which basically means the child gets what he wants, there's no problem, there's no issues, there's no deprivation of needs, then the child will develop normally and then grow into the next stage of life. But there's a problem, then in later life, the child will develop problems that is related to things that are symbolized by mouth. For example, drinking habit, smoking, uh, eating, nail biting. Hold on a second. Hello? Okay. Okay. Lepas tu tak tengok adik lah. Kemudian. Okay. Sorry for that. So that's the idea. So same goes with anal. So 15 months to 3 years, everything focusing on the anal stage. There will be problem, there's an issues. Later on in life, they develop either become anal expansive or anal retentive. So anal expansive, they become messy, wasteful, disruptive. If it's if it if the problem occur resembling anal retentive, so they become orderly, rigid, obsessive. Okay, so that is the example or the way that Freud tried to explain what happened. So the third stage is phallic. Phallic means your head. So the primary focus is on genital. This is when you started to develop um, uh, shame. You develop the idea about and so if there's a problem, what happens is become sexual deviances, sexual disorder, sexual fetishism, and so that kind of group, or they have issues with sexual identity um, as a result of problem in this stage. So if there's problem in these years of life, then that's what's likely to happen. A latency stage is where sexual is no longer in the forefront, it's at the background. The focus is on intellectual, social, and then there's another stage, genital stage, where sexual become focus again, but this is more with regards to relationship. Okay, so this is the theories from Freud. Now, so Freud's focusing on, but Erik Erikson, on the other hand, focused on social. That means Freud believed that your psychological development based on your sexual development. But the second theory, Erik Erikson believed that your psychological development relies on your social development. So social development is basically means how you fit into your environment, into your how do you fit with the rest of the world. Okay, so Erik Erikson Psychosocial development, on the other hand, is divided differently. It's divided into stages: infant, toddler, preschooler, school ages, adolescent, young adult, middle age, older. So you don't have to remember all this. Just have some idea what Erik Erikson psychosocial stages is. But according to Erik Erikson, each stage has its highlight. That means socially, you have things that you will focus on. For example, during adolescence, your focus is your identity. How do I fit with the rest of the school? Which group that I belong to? Which gang, which clique that you 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 belong to? As young adult, you start to highlight on the intimacy. Who am I going to connect with? Am I going to be loved? Can I love somebody? Can somebody love me? So that's the highlight. Middle age is about uh, it's about developing your intimacy. It's about developing your uh, eh, Okay. Okay, we'll carry on. Okay. So, so it depends on your age and the focus of that. The focus of that age. All right. Okay. So, okay. So each stage will have its psychosocial issues, will have its relational focus, which means social drive that the stage wants to highlight, and it has these central questions, like what I explained. You don't have to remember any of this. You just have to remember some idea what you just have to have some idea what sexual theory is and how it's different from psychosexual stages. All right, now next is Erik Erikson Psycho. Sorry. The next is John Piaget cognitive development theory. So we talk about sexual, social. Now the focus of this theory is cognitive, which basically um, which basically highlights the importance of your cognitive development in order to determine your psychological development. So Piaget came up with this idea based on his observation of his three children. So very small sample size, very Western bias. Some of his idea is actually um, uh, relatable with the way we understand about cognitive development of children today. Um, we have a look at the theory and see what we need to know about it. John Piaget theory is simple. It's divided into four uh, stages only. So the first stages is sensory motor. That means the child begins to develop through his interaction with the rest of the world through sensory and motor development. Second is pre-operational stage, where the child begins to represent the world symbolically, and then concrete operational stage, where they start to learn about theories, rules, and then last one is formal operational stage, where they start to develop understanding about abstract concepts. Okay, abang tak balik lagi? Abang tak balik lagi? Cakap kat akhir abang tak balik lagi. So, Uh, so you don't have to remember in details, but during the session, I will highlight what are the important concepts under stages. Right, these are some of the critics of Piaget theory, as I mentioned, as I highlight. And there's another theory which will not be covered, but I'll just put it there so that you understand. Another theorist, which is Kohlberg, look into moral development. So according to Kohlberg, moral also develop through stages. It doesn't occur spontaneously. Now, the last part is about adolescent development. Now, as what we discussed in childhood domain, adolescent also develop through these three cognitive, physical, through three domains: physical, cognitive, and psychological. Okay, so the first part, physical, is something that you probably will learn at some point during this medical school, um, uh, during your training. Basically, your physical development, height, weight, secondary sex characteristics, and brain development. Um, so these are some examples of physical development which happen rather very rapidly during adolescence compared to other domains of development. Second, second types of development under physical is secondary sex changes, which is something that you will also come across in the developmental theory in physiology study, and it's driven by a biological process as well. So just now we talked about sexual, social, cognitive, that's psychological. But when we talk about physical development, it's actually something that we cannot control. It's automatic process that occur as a result of interaction of physiological changes. Of course, driven by endocrine system. The third part of physical development is brain development, which is also another important part. What's interesting about development of adolescent is the rest of the brain will develop before the cognitive part of the brain. That means the puberty will come first, the physical changes will come first, but the cognitive only fully develop in early adulthood. So therefore, you have a physical of a person who is close enough to physical development of an adult, but the brain is left behind. The brain um, is not in keeping with the physical development, and this actually explains why there is emotional and psychological problems occur during adolescence. Okay, I will explain about this graph or this graphic in the class and talk about how it relates to what we see in psychological disorders of adolescence. All right, so the changes actually affect teenagers in their behavior, mainly in their behavior. So the fact that the physical and the cognitive is not in synchronized, the results of that is basically their behavior. So they are more prone to vulnerable risk-taking behavior. They are vulnerable to poor decision-making process, and as a result of that, they have higher tendency of psychological and social issues during adolescence. So that's why 50% of mental health problems that occur in adults started before 40 years old. Okay? So we will talk about this later. Right. Now, with regards to psychosocial development, some of it actually covered under what we discussed earlier on. So, some of it already explained under psychosocial development in Erik Erikson. Um, the fourth component of Piaget, the formal operational cognitive stage, is what expected to happen in adolescence. So a lot of it is basically continuation of childhood development. So the highlights of psychosocial development in adolescence is uh, where they are in the process of establishing their identity, autonomy, intimacy, uh, become comfortable with their sexuality, and started to highlight about self-esteem, achievement, what I can do, what am I good at. So that's their psychosocial development. In order for them to fit into the next stage of life, which is general, general, general ability. That is ability to be productive, which is the highlights of adulthood. Okay, so that is, in essence, what we will cover, what we need to understand with regards to child and adolescent development. Okay, so I'll share with you the slides um, and we'll discuss. So have a look at it, read the slides over, try to make sense what I've shared with you, and later on, I will um, we will discuss during the class about what what you need to know for exam purposes. Okay, we will discuss about questions and answers during the session. Okay, so that's all. Assalamualaikum warahmatullahi wabarakatuh and a very good day. Assalamualaikum.